Welcome to the show. I'm Kathy Ireland. Millions of people worldwide suffer from overactive bladder, bowel incontinence, and/or urinary retention. These conditions can significantly lower quality of life. Today, we have Karen Noblett, MD, Chief Medical Officer at Axonics. Karen, welcome to the show. We're so glad you're here. Can you please tell us a little bit about what is incontinence and what are the different types that people may be experiencing?
Absolutely. When we think about incontinence, we could separate it out into two main buckets, urinary incontinence and bowel incontinence. Okay. With urinary incontinence, there are two main types. One we call stress incontinence, and that occurs when women are coughing, sneezing, laughing, anything that increases that intra-abdominal pressure. The other type of urinary incontinence is called urgency incontinence, and that's when a patient might feel a sudden, compelling urge to go to the bathroom, and they can't quite make it. And then we have bowel incontinence, and bowel incontinence is when patients have the inability to control their bowel movements and have an accidental loss. We call it also accidental bowel incontinence. Now, these conditions can really have an impact on quality of life. They have an impact in the social domain, in the physical domain, and even in the sexual domain. Many patients are, afraid to be intimate with their partner because of fear of loss of urine during that activity.
Right. And what treatment options does Axonics provide to help women who suffer from stress urinary incontinence?
Well, stress urinary incontinence is typically related to a decrease and a weakness or a weakening of the pelvic floor muscles. Mm-hmm. And part of that musculature includes the urethral sphincter. So the urethra is the tube that we urinate through, and it's surrounded by muscle. And again, as we age, that muscle may become weaker. And as it becomes weaker, the outlet resistance reduces. And so one of the things that we have done and provided is to develop a product that we call Bulkamid. And Bulkamid is a treatment option where we can actually, through a very simple and safe procedure, inject this hydrogel. So it's basically a water hydrogel that we inject into the urethra to sort of plump up the tissue to increase the outlet resistance. And it's been very, very effective. And we've treated hundreds of thousands of women with this product.
And Karen, I understand that Axonics also offers sacral neuromodulation therapy, which treats overactive bladder, urinary retention, and bowel incontinence. Can you talk about this therapy?
Yeah, sacral neuromodulation has been really revolutionary in being able to provide effective treatment for these conditions that are chronic and have been refractory. So sacral neuromodulation is a therapy that can actually restore normal function. So when we talk about urgency incontinence and bowel incontinence, it's thought to be related to abnormal or miscommunication between the brain and the bladder, the brain and the bowel. Mm-hmm. And with sacral neuromodulation, we can provide, through gentle stimulation, a restoration of that normal communication and thus then restore normal continence mechanisms.
Thank you so much for joining us today. Thank you.
Thank you so much for having me, Kathy. Really a pleasure.
Thank you. And thank you for watching. I'm Kathy Ireland.